So I don't have that much new in terms of information to present this week. I think the story is relatively similar to where we were a couple weeks ago. I started off by looking at the provincial wastewater data. There is a little bit of a new development in that we've seen a little bit of a flattening out of what our wastewater data has been showing. The province was very optimistically hoping that this was going to be a peak and that we would see a downwards trend from there. It doesn't look like that's taken place. There's maybe some sense in the provisional estimates that it's trending down, but I think we could just as easily see that this is going to start to trend up as an impact from the long weekend. So I think it's still to be determined where we are headed. Certainly, though, I don't think there's a strong signal that we have peaked and we are coming down on a controlled decline that's going to look similar to what we've had in past waves. Just looking at the regional breakdown here of wastewater data, it's important to note that it's not necessarily the same trend everywhere. And I particularly note us here in the Central West region, our region is still showing an upwards trajectory. And you can see in Northern Ontario, unfortunately, they seem to be showing a very sharp upwards trajectory, at least in the preliminary data. If I actually take a look at our wastewater treatment plants here in Niagara and what we're seeing, I'll start off actually with the Port Wells plant in St. Catharines. You can see we've risen, and maybe there is a sense that we're kind of holding steady at a relatively high level. It's maybe a little lower than we were in the past wave, but nonetheless pretty high compared to where we were, but not necessarily continuing to trend upwards. If I look at the Niagara Falls wastewater treatment plant, this is, I think, a little bit more of a pessimistic sense. There is some sense that we're continuing to go up and hit new highs, and these levels are actually getting very close to where we were during the Omicron wave. At the Fort Erie wastewater treatment plant, I think we've actually had an all-time high within the last couple of weeks at this plant. And I think these levels are pretty similar to some of the levels we're seeing during the Omicron wave. The Welland wastewater treatment plant, I think likewise, we're seeing kind of high levels similar to what we had in the Omicron wave. And there's no real sense that things have flattened out yet. This could still be an upward trajectory here. This is the Grimsby wastewater treatment plant, and you can see over the last week, they've been hitting higher levels than they've had previously in this wave, and actually higher than they've had during the Omicron wave. And so I do think there's still, perhaps increasing COVID-19 happening in some parts of the region. And then finally, just showing you the Crystal Beach wastewater treatment plant. Again, it's kind of similar to Grimsby, where we're actually seeing higher levels recently than we've seen in the preceding weeks. So there's no sense to me here that we've necessarily seen a peak yet in terms of the wastewater, at least for some parts of Niagara. And I think we may still be seeing things heading upwards. I hope the province is right and we actually are hitting a peak and we're going to start to trend down, but I don't think we have any reliable sense in the wastewater data to show that yet. And I think we need to be realistic and not necessarily overly optimistic about what we're seeing. Switching to taking a look at what we're seeing with our cases per week, we have seen a little bit of a flattening out in terms of our infections in Ontario. And likewise, the trend here in Niagara is showing a little bit of that. That could match then with what we saw in the wastewater data about numbers flattening out. One challenge we did here at the provincial level, though, is that there were issues with their sending out lab results from people who had tested positive. So we may be seeing a bit of an artifact of that in terms of the system was not properly reporting infections. That being said, if we look at the percent positivity data here in the province, there does seem to be a small downtick, which maybe is more consistent with we have actually flattened down in terms of our number of infections, at least temporarily. In Niagara, our percent positivity does seem to be a little bit flat over the last 3 weeks or so as well. Shifting now to looking at hospitalizations. Hospitalizations are always going to lag the pattern we see in cases and in wastewater. And so no surprise, we are still seeing an upwards trend in the province-wide hospital data. The ICU data, fortunately, is showing only a very gentle incline, and we're hopefully not going to see the kinds of spikes that we've seen in past waves. But we are, I think, going to be still seeing increases in hospitalizations for a little bit. And if we look at the Ontario Science Tables monitoring that they put out a little over a week ago, this is what they expected, with some scenarios showing that we could see hospitalizations actually exceeding what we had during the Omicron wave. More likely, we're going to stay a little bit lower than that, and we're fortunately currently tracking closest to this green line. So hopefully we will be under what was predicted, under what was experienced during the Omicron wave. I do know that, from mid-April where we are, I guess we're a little past mid-April, third week of April here to where we would end up, there's still an increase for a couple of weeks to come. And so I think we need to be mindful of that. And of course, there's still a possibility that we don't see a peak in the wastewater, in which case perhaps this peak gets pushed out a little bit later. This is the ICU numbers, which show that the ICU numbers will probably stay a bit lower than the Omicron wave. I do want to highlight, though, that while our hospitals may be able to handle the number of patients with the beds they have, this is what our hospitals are seeing in terms of healthcare workers who are off with COVID-19 or isolating as contacts. And you can see that they have once again hit the peak that we had at the Omicron wave. So there's a substantial number of healthcare workers, far higher than we had in past waves, that are off right now, which means that while we might have physical beds, we won't necessarily have the people to staff those beds. And you can see that the hospitals never really came down to a low level of people being off work. They, started to come down, and we basically rebounded into this wave. And so that's going to be an ongoing pressure for the hospitals. And of course, hospital workers are people who are generally triple vaccinated. If we think about the rest of the community, people in workplaces and schools, I'm sure they are seeing high absenteeism as well from the workplace, from going to school, because they are also getting sick. They're also having to isolate, and they're not having the same protection from the 3 doses. They're probably going to be even worse than the healthcare workers are here. Looking here then at Niagara's hospital numbers, pretty similar trend to the province. We're seeing that upwards trajectory when it comes to hospital numbers. And actually twice last week, we hit the peak of where we were during the 3rd wave. ICU numbers have fortunately been flat, but of course we're not yet through seeing what the hospital numbers are going to do, and I expect this is going to keep going up, and we're almost certainly going to beat what we had in the 2nd and 3rd waves in terms of hospitalization. If we focus specifically on patients who are admitted for COVID-19 as the reason for being hospitalized, there is a slightly positive sign here where that hasn't grown as quickly as the overall hospital numbers. And what we're actually seeing here is, unfortunately, the hospital is experiencing outbreaks now. And because Niagara Health has those outbreaks, that's causing a fair number of people who are unfortunately having COVID-19 who are in the hospital. That may mean that it's not their primary reason for being hospitalized because they're hospitalized for something else, but those are also probably relatively more vulnerable people. And so COVID-19 shouldn't be treated as something that's just incidental. It is something that's likely going to harm their clinical outcome by virtue of them having to suffer that as well. Just looking here at the outbreaks, I mentioned that we've seen more hospital outbreaks, and we can see we've seen this increase in outbreaks in really all settings in healthcare over the last couple of weeks, which is consistent with more infection is out in the community, so more people are bringing in that infection either as employees or as visitors. In terms of the average number of people being hospitalized per day over the last little while, we've been in the 1 to 2 people being hospitalized per day, which is definitely higher than we were before. Maybe, this April 21st data is the first sign of a little bit of a drop off in that, which, would be consistent with what I showed you in the previous slide, where our people being hospitalized specifically for COVID-19 was going up, and then it was only more gently going up. And maybe we're seeing a bit of a drop off there, but we'll have to see if this is sustained or not. What I think is, very notable is the number of acute beds in the hospitals in Niagara that are occupied. And, I think a couple of weeks ago when I presented, they were about 102%. We're closer to 107% now. So there's a substantial number of hospital beds being taken up in our hospitals. They do not have a lot of capacity. So this isn't just a matter of that there's hospital beds and the hospitals might struggle for workers. They're actually probably going to start to struggle with beds as well, which is why I think we need to make sure we're not taking chances with increasing COVID-19 and increasing hospitalizations in the coming weeks, because I don't know how much more our hospitals are going to be able to weather that storm. Finally, just taking a look here at deaths data. Unfortunately, we are still seeing deaths remaining at a relatively elevated level. Fortunately, not seeing the spike that we've seen in past waves, but definitely higher than we were between waves or in the summers over the last couple of years. And hopefully that is something that we can bring down by better controlling this pandemic going forward. Taking a look here at the deaths in Niagara, similar story. We're once again seeing people unfortunately passing away from COVID-19 after going through a few weeks with not having quite so many deaths. So, I've highlighted that we're still seeing deaths, we're still seeing hospitalizations, we're still seeing many people having to isolate because of COVID-19. And those are still, I think, remaining concerns and reasons why we need to continue to take this virus and this ongoing pandemic seriously, and not just return to life like it's 2019 and let the virus keep spreading, because that means we're going to keep seeing more infections, we're going to keep seeing more people hospitalized, we're going to keep seeing more people passing away. But of course, the other thing we'll see is more people who suffer from long COVID. And this was some data that the Ontario Science Table put out, just looking at this set of basically cardiovascular issues, and that within 1 year after COVID-19 infection, for every 1,000 people, you're going to see a substantial number of increased heart issues. So for example, if we're looking at atrial fibrillation, that is a issue of the rhythm of your heart not being working properly. For every 1,000 people who end up in an ICU, we're going to have 90 who have a newly developed issue with atrial fibrillation. For every 1,000 people hospitalized, we're going to have maybe 45 to 50 people who develop this atrial fibrillation. So, that's, 9+% of people in the ICU, 5% of people hospitalized. We'll even have percent of people who just have mild COVID-19, get better, never need hospital care, who are more likely to end up with this condition. And you can see across all of these conditions, even the people who are not hospitalized are ending up with increased risk of these cardiac illnesses. And one of the risks we have of seeing lots and lots of people get COVID-19 and not controlling it is that this admittedly not huge percentage of people is going to be applied to a very large number of people who have infection. And we're going to see an overall increased health burden to our healthcare system as a whole. And so our healthcare system will deal with all of the usual illnesses it's dealt with. It's going to deal with ongoing COVID-19, and it's going to deal with these increased, chronic illnesses as a result of people previously having had COVID-19. And I think it's really compelling reasons for me why we want to try and manage this pandemic. Obviously, doing so in a way that's sustainable, that's not restricting our social lives, but also not ignoring the pandemic and letting it continue to infect people without too much concern, because it's not just hospitalizations we need to be worried about or people passing away, and unfortunately we're seeing that. It's also the many, many people who are going to live with long-term disabilities and chronic illnesses due to COVID-19. And the one other thing I just want to highlight is that we always need to be worried about new variants that could show up. The more infection is spreading, the more opportunity that virus has to mutate and for new variants to come about that could be concerning. And I note that New York State is currently reporting that they've got a couple new subvariants of Omicron that are spreading there, and that seem to spread more easily than the BA2 variant, which is already spreading more easily than the original Omicron variant. And I don't know if this has shown up yet in Canada. We don't have any data on that, but obviously if it's in New York State, it's a concern that it could bleed over here to us in Niagara. So I do think we need to still be mindful about this pandemic going forward and continue to take steps to control COVID-19 to make ourselves safe and to limit the spread. Obviously, the #1 tool we have is vaccination. And I just want to highlight this data put out by the Ontario Science Table. And what they're looking here is that people who have 2 doses, who have 3 doses, and unfortunately nonetheless still get COVID-19 infection. It wasn't able to protect their infection. We know sometimes the people will still get infected despite being vaccinated, but this is how much virus they find in people on average. If they have 2 doses and they got infection versus they have 3 doses and they got infected. And you can see with 3 doses, there's a lot less virus. And that means probably the infection is going to be milder, but it also means there's going to be less virus in a person's body to be spreading out and infecting other people. And so the more people we have that have 3 doses, the better protected they are from Omicron and from COVID-19 generally, but the more they are going to be protecting everybody else because they're less likely to spread the virus to others. And I think that is really key. We need to get people up to 3 doses because that's going to be a key way we slow the spread of infection in our community, on top of making sure that those who do get infected are least likely to suffer some of the significant negative consequences they do get infection. Important to note here that even if we're looking at protection against hospitalizations, with 2 doses versus 3 doses, there is an increase in protection there, you can see. And you can see the waning that happens with 2 doses is stronger than the waning that happens with 3 doses where it's less. And so 3 doses is going to give even, not just reduce the chances of serious illness, but also keep that protection longer. And as I showed in the previous slide, make sure you're less likely to infect others. When it comes to our vaccine uptake here in Niagara, we still have very good uptake, of course, our first 2 doses, except in this youngest 5 to 11 age group. We're not doing quite as well when it comes to 3 doses. 3 doses is pretty good once we're in our older age groups here, but we still need a lot more vaccinations of 3rd doses by our younger age groups to get them closer to where that 2-dose number is. If we did that, that could substantially reduce the number of people who are out there spreading infection, as well as perhaps being hospitalized, and really decrease the ongoing impact of this pandemic. And one of the most important things that we can do to make sure we control this pandemic and limit those, hospitalizations, that death, that long COVID, and all the suffering that the pandemic will continue to bring, is get people up to the 3 doses of vaccine in the next little while. And I really do feel there's more room for the province to be promoting the importance of vaccination rather than being relatively silent on the role of vaccination and relatively silent on the pandemic as a whole. Now, I just want to highlight this story that shows in our long-term care homes how important vaccination has been. So, of course, we know long-term care home residents were dying far higher in rates than people in other settings. You can look at 80 plus, who are, of course, the highest risk group of dying from COVID-19, died much less than people in long-term care homes back in our first wave. In the second wave, you can see that risk of dying went up for the 80 plus group. It didn't actually go up for the long-term care home group by much. And that's because partway through wave 2, we were able to start vaccinating people. And so we're able to put a stop to people dying pretty, partway through that wave, so we didn't see the full brunt of it. And by the time the 3rd wave hit, you can actually see the risk of dying in long-term care was lower than for the 80 plus population, because by the 3rd wave, we had gotten 3 doses for this group. 80 plus people only had 1 dose, but long-term care home residents had 2 doses, and you can see the real impact that made on them surviving. Wave 4, likewise, we did not see these massive number of deaths thanks to them having 2 doses. Wave 5, unfortunately, with the Omicron variant, the vaccine didn't work as well, but even then, we had got 3 doses out to them, and it definitely prevented them from that most serious outcome of passing away, even while the vaccine perhaps worked less against that variant. And so vaccine has made a real difference in people, being able to weather COVID-19 better. And we need to make sure that this, story gets applied to across all our age groups. It won't be as dramatic, perhaps, for younger age groups, where unfortunately the risk isn't as great, but I think there's still a role. And I think there's a really important role to be promoting vaccination much more. We're not seeing a lot of vaccine uptake right now. It has gone up a little bit, but it's largely people seeking out a 4th dose these days. We're still seeing some increase in 3rd doses. We're, getting a few hundred done a week. But I think, if we got more promotion, especially by the province, we could hopefully start to see higher numbers, maybe similar to what we had in past waves, and, really get more of our population protected. We're still running our vaccine clinics here in Niagara, and this week we'll be at the Canada One Outlet Mall. As well, we're going to be doing a pop-up clinic at the Wainfleet Community Hall as well near the end of this week on Friday. So that's the vaccination story. The other tool we have that, I've talked about needing to use more has been treatment. And there's actually been some good news on treatment. At the province 2 weeks ago, announced they're expanding access to COVID-19 antivirals. I think that's maybe a misstatement that it was really expanding access, because the same people are still eligible for antivirals, but they have eased access for those people, I think, a little bit. And I think that's definitely a good news story. I've talked about in the past, knowing if you're eligible for the antiviral treatment was really difficult to figure out. It wasn't a simple, rule for people, and that people would need to reach out to their primary care providers to figure that out. I think that remains the case. One thing I've said in the past is the province should have just say a blanket rule that anybody 50 plus can get tested, because once they're tested, we can then filter out the people who should get treatment and be able to identify them. And everybody 50 plus getting tested gives you a simple rule for people getting tested. The province didn't quite go there, but they did actually go part the way there. And what they've done is they defined higher risk groups who are now eligible for testing and encouraged to go and get PCR testing right away. Still a little more complicated than I would like, but I think it's definitely simpler and much easier for me to explain than the actual people eligible for treatment. So if you're over age 70, you're eligible to go get tested. If you're 18 and up and you're immunocompromised, you're able to go get a PCR test. If you're 60 and up and you don't have your 3 doses of vaccine yet, you're also eligible to go get PCR testing. And again, if you're 18 and up and you have one of these medical conditions, you're higher risk, you're eligible to go get tested. And once these people go get tested, they'll have a PCR result. We'll be able to sort out who should be, getting treatment and who shouldn't. And that's one way that I think this is going to be simpler, by actually making sure we get these people tested and we can identify if they need treatment or not by now looking at them. The other thing the province, of course, did is they simplified access to getting treatment. So you don't need to go from your primary care provider, be referred to a central clinical assessment center in Niagara. Your primary care provider can now actually, in many cases, just prescribe you the medication. You can go to a pharmacy, fill that prescription like anywhere else, and it actually starts to become much more like treatment for any other condition. So the advice I have is for people who are in these groups, if you get sick, contact your primary care provider right away, get an appointment so you can figure out if you're going to be tested, and immediately book a PCR test, because you're going to need that to find out if you actually have COVID-19 and can get a PCR test. So 2 simple things: if you get symptoms of COVID-19, book an appointment with your primary care provider, get a PCR test. If you're not sick, I think something you can still do is contact your primary care provider and have a conversation to them to understand the role of treatment, whether you'd be qualified, and any advice that they have for you in that situation, so you're proactively prepared for that scenario if it does arrive. And I think, this is a much easier, message, I think, for people to take. And I think this is hopefully easier for people to tell if they can fit within those criteria to get tested. The province has also put up this helpful screener here at this website here, where anybody can go in and answer a few questions, and they can find out if they're potentially eligible for treatment and whether they're eligible for testing. And so that's another thing people can do proactively, is to go fill out the screener and clarify that. And so definitely some good progress here to make treatment more easily available to those who need it. I think there still needs, though, to be more promotion of treatment. I'm not hearing a lot about that. I haven't heard the province really out and spreading the message that these groups need to go out and get tested right away. I think we need to have more promotion to make sure those who need treatment are actually going out and accessing it. And I'm also mindful that people who aren't connected to a primary care provider, who may have language barriers, who may be of minority races, they're going to continue to be the people at greatest risk of COVID-19, and we need to keep doing more outreach to make sure those people at greatest risk are also getting some help to access this treatment if they're eligible for it. Final thing I want to talk about is masking, and I've been quite vocal that I think masking needs to be something that's maintained in the province. Obviously, the province's emergency regulations, including the remaining masking requirements, were going to expire this Wednesday. And we heard last week from the province that is indeed going to happen. That being said, the Chief Medical Officer of Health is actually going to extend the masking in some of these highest risk settings going forward. And I think it's notable that this is not being done by the provincial cabinet. They're letting their mask regulation expire. But what the Chief Medical Officer of Health is actually doing is he's issued a Section 22 order to continue masking in those settings. And I think this is a really positive move by the Chief Medical Officer of Health. I think this is absolutely the right decision he's made to continue making sure we don't further step back away from masking. And I think the fact that he's done a Section 22 order now, his lifted the precedent that that's something that's not been done in the province. And now that's been done, I would ask that the Chief Medical Officer of Health actually expand what's covered by that Section 22 order to actually bring back broader masking, bringing it back to schools, bringing it back to workplaces, and maybe even to some of the high-risk social settings, so we can have better protection in the next few weeks while we're going to be stressed from more COVID infections. We're going to see hospitalizations remain high. And we can keep those for a few weeks and then take them away once we see the hospitalizations come back down and we see the infections also come back down. So, great move to, issue this Section 22 order. And I think it's, I encourage the Chief Medical Officer of Health to extend that order to apply to more groups so we can properly protect our population going forward. And with that, I'll stop and I'll turn it over to Courtney to moderate the questions.
Great, thanks, Dr. Hergy. Up first, we have Alan, and you should be able to unmute now.
Hello, hi, Dr. Hergy. Just wondered with the emergency orders to expire April 27th, is there a greater impact? I mean, you guys won't be reporting numbers on the weekend, for instance, but I wondered if there's a further impact that public health is going to be experiencing because of the staff no longer being able to be redeployed.
Yeah, I think it affects us in a couple of ways. First off, it makes it harder to have our staff within our collective bargaining agreements to work weekend shifts. Still possible. It's going to take more, it's going to be more costly for us to do that and more difficult to negotiate those changes in schedule with our unions. So that's going to be one impact that you'll probably see, is that there's going to be less staff working weekends and less support. That can mean that you may see less vaccination clinics offered on weekends, which is a shame because I think right now we in the public health are actually doing the majority of weekend vaccinations while pharmacies do most during the weekday. We're going to try and find ways we can work around that. We're also going to have fewer people doing contact tracing and outbreak support on weekends. And so we're going to shift to having most of our work done during weekdays. I think the other challenge it's going to potentially give us is that when we have future waves, we're going to have less flexibility of changing what our staff doing, redeploying our staff to address what's happening in that wave going forward. It's harder to say in concrete terms what that would look like, but it's taking away that flexibility.
Okay. Are you facing, I mean, we've got 327 last week hospital staff that were in self-isolation. Are you guys facing the same sorts of staff challenges that are going to be more or less aggravated by the emergency order being lifted?
We're definitely having challenges in terms of staff getting sick with COVID-19, having family members sick with COVID-19 and have to be on isolation. It is only had, I think, a small impact on our service delivery because one of the fortunate things we have in public health is that we have the ability for lots of people to actually work remotely. And so people might be sick, but in many cases, they're well enough that they can work remotely, or they're isolated because a family member is sick, so they're actually still able to work remotely. A lot of our in-person services, as you know, have been on pause during the pandemic. And so there's relatively little service that has been impacted by people not being able to work on the front lines. And we have enough redundancy of staff. So for example, if people are off in our vaccine clinics, because we're not seeing a huge number of people, we have enough staff that we're able to reallocate them. So it's definitely having an impact in a small scale, but fortunately it's not having a huge impact on our ability to deliver services. That's obviously a very different story from a hospital where you actually need to be on site caring for patients. And so when people are off on isolation, it has a much bigger impact on the hospital than it does on us.
Excellent, thank you.
Thank you. Up next, we have Dawn, and you should be able to unmute.
Yeah, hi, Dr. Hergy. Thanks very much for taking my question. I think the only question I have really is just in terms of demographics and in terms of cases and people that are being hospitalized in Niagara. Is there any indication of what that would be? I mean, if I went to the website right now to the dashboard, it would indicate that, women aged between 20 and 59 are most likely getting the virus right now. Is there anything that you can tell me about that? I'm assuming, as far as I know, wastewater data, of course, does not, discriminate by demographic.
Yeah, so in terms of who's getting infection, it's definitely that 20 to 59 age group. And I'd say probably the 20 to 49, even more than the 50-year-olds, 20 to 39, sorry, more than the 40 and 50-year-olds. That's where we're seeing the most infection. And that kind of makes sense if you look back at what I showed you earlier around the vaccination numbers. Those are the groups with the least likely to have 3 doses of vaccines. Those are also age groups where they likely have children. So children are going to school, a lot of infections sadly spreading in school. children are bringing it back, and it's then spreading to the adults who then are unfortunately getting sick with COVID-19. These are also working age people, so they're out and about, they're at work, they're potentially exposed to people at work getting sick. So definitely that younger age group, that 20 to 39, and then even the 40 and 50-year-olds are where we're seeing most of our infection, which is why I think it's so important we get them to get their third doses and find ways to convince them or give them incentives to get the third doses. When it comes to hospital numbers, if you actually go to Niagara Health's website, they have some good data there with age breakdowns on who is being admitted to the hospitals with COVID-19. And it's overwhelmingly actually people who are age 65 and up who are being hospitalized. We have some people in the 40 to 65-year age group. There's a handful of people younger than 40 as well who've been hospitalized, but it's overwhelmingly that older age group of 65 and up. And I think that's consistent with what we've seen throughout the pandemic, that older people are at the greatest risk of severe illness from COVID-19. Fortunately, much of that age group has been vaccinated. We're seeing a disproportionately high number of unvaccinated people as the hospital admissions in that age group still, but still, unfortunately, we are seeing vaccinated people who are nonetheless being hospitalized. And I think that's a reason why it's so important that these younger age groups get vaccinated, so they're less likely to spread it to older people who may be within their social circles and their families, or maybe whom they happen to work with.
Thanks. And a follow-up?
No, I'm good. Thank you.
Thank you. Okay, then up next we have Penny, and you should be able to unmute.
Hi, thank you, Dr. Hergé. I know you're asked this pretty well every time you have one of these conferences, but if you're saying now that the Chief Medical Officer of Health has thankfully used a Section 22 regarding mask wearing, if it doesn't spread across the province, have you had any discussion with other people in your position about doing that yourselves?
Yeah, we've had conversations around Section 22 orders, perhaps done at the local level, and there's various opinions on that. As I've said before, it remains something that I'm quite focused on. I think with the Chief Medical Officer of Health being willing to do a Section 22 order now around masking, my hope is that we can try and get a consistent mask rule issued by him across the entire province that applies to more settings than just the original high-risk settings. And so my focus remains on convincing there, with a shift that maybe we're less trying to convince a change in provincial policy and shift in trying to convince the Chief Medical Officer of Health to do that. I am mindful that we're seeing some signs in the wastewater data, things that might be flattening out. So I am a little bit cautious about wanting to rush too quickly on doing a local order now, especially if it suddenly turns down and people start to claim it might have been unnecessary. I also think that this is not going to be our last wave. We are going to see waves return, and I really think we should have a provincial approach to dealing with waves that are going to apply across the province, and that should be a province-led masking requirement during those periods where we see higher risk. And so I remain committed to try and encourage that to be the solution we come forward with.
And a follow-up?
Yes, I'm just wondering how regularly you have the opportunity to have those discussions with other people in your position and with the provincial Chief Medical Officer of Health.
Yeah, so communications with other medical officer of health. Usually there's at least one meeting that's either with all of my counterparts across the province or at least with my counterparts across the GTA that we have every week. And then in between those meetings, there's lots of one-on-one or groups of 3 of us conversing about how we're dealing with various things in the pandemic, or often we talk about this issue as well.
Okay, thank you.
Thank you. Okay, we've come to the end of the list. So we do have some time left for second questions if anyone has any. So if you can let me know in the chat, then I can let you unmute. Okay, not seeing anything in the chat. We'll end things there. Thanks all for attending, and we'll see you again next time.